What has gone wrong is that there has been lifestyle modifications. We used to see very few cases of PCOD when we started practice. But now I think 30% of our OPD is PCOD. Infertility in the younger girls who are getting married. Then we see more and more hair growth on the face, then having a lot of acne, obesity. These are issues we are getting in very young girls, as young as 10 years.
Welcome to episode 2 of Woman Ki Baat. Today we have with us Dr. Manisha Singh, senior gynecologist and obstetrician at Altris Healthcare. Welcome, Dr. Manisha.
Hi, Priyanka. Thank you.
So, you have 25 years of experience in women's healthcare. So, over the years of 25 years, what changes have you seen?
See, we've seen a lot of shift in healthcare, more and more education with the advent of social media, with the advent of Google. A lot of knowledge has spread to the masses. But what has gone wrong is that there has been lifestyle modifications which have been taken a back seat. So a lot of lifestyle diseases have come up. Initially, we talk about PCOD. We used to see very few cases of PCOD when we started practice. But now I think 30% of our OPD is PCOD.
That's very interesting. So, what are some of the health issues that you're seeing in women now which didn't exist a few years back?
Like I said about infertility in the younger girls who are getting married, then we see more and more PCOD and dysfunctional uterine bleeding in girls who are starting their menarche. Menarche means when you are attaining your menstruation for the first time. So at that age, we did not have issues like irregular periods. We used to have in the initial times also, but now they are associated with a lot of health issues like hair growth on the face, then having a lot of acne, obesity. These are issues we are getting in very young girls, as young as 10 years, right? Talking about age of menarche, coming to young girls, so menarche at our times when we were in school or we attained menarche, the average age was around 13 to 14 years. Now it is around 9 to 10 years. So that is the change which has come with development, we can say, with more intake of fat and carb rich diet that we are taking, more sedentary lifestyle in school, too much of stress of education and peer pressure of trying to excel in all fields. So that has what has changed probably for females in the last 2 or 3 decades.
Talking about young women, what is the one women's health issue that you feel girls should know from an early age?
See, knowing about one's body is of prime importance. The most important thing that any girl or woman should know is trying to analyze what your body is saying. Nowadays, what is happening is we are trying to learn from outside. We never think that this is normal. So, if you are not menstruating on time, if you are not having a proper flow, if you are having a lot of weakness, you need to go and see a doctor or at least reach out to your mother and inform of these changes. Most of the time, children will have issues, but they will try to read on the net or talk to their friends and not actually go for help. So, by the time they reach out for help, is when the disease has already progressed and which they probably read on the internet and thought that was normal. So, there is no amount of bleeding during menstruation which is more is normal. So, if what is normal? First, we need to know that. And who's going to teach us that? Schools are not teaching. So, where do we get our information? Either from the mother. So, one important thing, go for a routine counseling to a gynecologist. It's not a taboo. Talk about it. It's something which is occurring naturally to us. We talk about our hair problems. We do not hesitate to go to a dermatologist or to a hair care center if we are having hair fall. But we hesitate to go to a doctor, especially a gynecologist. The taboo is you visit a gynecologist when you're expecting or you have a problem. So, when you already have a problem, the disease has already taken its course. So, there is nothing preventive which can be done. So, if we approach the doctor earlier for a yearly checkup, it doesn't hurt.
That's a very important issue that you have raised, which is why we are discussing on Woman Ki Baat, a platform where we can talk about these issues. Because, as you rightly said, young women have a stigma or a taboo around discussing these issues. So, can you bust a myth around periods which you feel these young girls have, which they are not discussing?
There's a lot of myths around periods. Most of the people will say, okay, we should not have coffee, we should not have ice cream, we should not go out to play, we should not do our regular physical activities. They're all myths. So, this is just a change which is occurring for a few days. And it is a lining which was prepared for conception. And since there was no conception, it is being shed. So, you're losing something like 50 to 80 ml of blood. That's all. So, even if we give around 500, 350 to 500 ml of blood, which we give on a blood donation, we go to work, right? That doesn't hurt. So, how can 50 to 80 ml of blood, which is not even a very useful part because it was not in circulation, it was just lying in the uterine lining, so it cannot cause weakness. So, that is a myth that we are menstruating, so we should be in bed. See, but then people will say why it was done earlier. See, in the earlier times, we did not have so much of cleanliness. We did not have so many uh, facilities available. So, women were kept in a separate place, and there were things which were related to religion so that they would abide it. So, those were at those times. At these times, we just need to be very, very conscious of our hygiene. That is one thing that should be prime. Should be changing your sanitary napkins once in 4 hours. If you're using menstrual cup, make sure that you're evacuating them also every 3 to 4 hours. And otherwise, it's just a normal phase. Drink lots of water, have lots of green vegetables and fruits, hydrate yourself well, eat a lot of protein rich diet in the times when you are going through your menstruation so that you don't feel too weak.
You're correct, ma'am. But there are two sides, like you mentioned. One myth is that girls cannot enter the kitchen or touch pickles, because they are menstruating, or they can't go to the temple. But then there's the other side, which has severe cramps or, endometriosis or issues like that young girls are suffering with. So, when girls come to you with the second issue, what do you advise? What is your advice to them?
See, any minor cramping, how do we differentiate that you are having a normal period cramp or it is something more? So, normal period cramps usually start before you are starting the menstruation flow. Once the flow starts, the cramps normally subside, and you take a hot water bag and they're done. Most of the times, you do not need medication to suppress the pain, and they do not affect your daily activities. In younger children, they would be harder because you have to understand the muscles are much stronger. So it is actually the muscles which are contracting and letting out the blood. So the pains occur. But if the pain is severe through the flow, throughout the 4 or 5 days, please contact your doctor. They will order an ultrasound to pick up endometriosis or some cysts in your ovary, which might be triggering these kind of severe pains. So we need to catch them early because if they are problems like this, they go on increasing with each menstruation and they will cause scarring. And by the time these children become adults and they reach the childbearing age, we have issues of infertility.
If a woman feels shy or uncomfortable to discuss certain issues with their gynecologist, then what do you do to make them feel comfortable?
This shyness, I don't know, there's nothing to be shy of me or any gynecologist. We know everything. And whatever you're going to tell me is not anything that is going to be new to me, or I'm going to be shocked by reading it or knowing it, So it's just not. There is a kahavat na, dai se kya pet chupana. So that is exactly what it is. Ki from a gynecologist, you should not hide. है ना? From a lawyer, you should never hide. So similarly, it is, how am I going to help you if I don't know? And some people feel that probably, see, in Dehradun, for example, it was a very small city. So most people are scared that probably if I discuss something with the gynecologist, my gynecologist would be knowing my mother. So it might just go out. So now girls are sexually active and they are quite open about their sexuality also. So no harm in it. Please discuss freely with your gynecologist. None of the gynecologists, not me especially, will ever judge a person. It is your choice. I am here to help you make the right choices so that you do not go through a difficult time. And later on, you come back to me or any other place and you suffer. That is the idea. So the woman should not suffer because of any wrong decision that she might have taken regarding her sexuality. So be very open and very frank with your gynecologist. Tell whatever you have done. Just an example, I'll tell you. There was one girl, she visited my OPD, and young girl, and she wouldn't speak. So the person who was taking the history outside, my staff nurse, she was just asking, "Hua kya hai?" So then I just want to talk to the doctor. So I told them, I said, kindly leave. I told all the staff and the people to leave the room so that I could sense that she wanted to talk something personal to me. So sometimes if you have too many people in the room, you can just ask your doctor. She will give you specific time. And then she was able to discuss something very personal, which she just wanted the gynecologist to know. So those are the things that we help to make their journey and their interaction with us more upcoming.
So many women worry when their period is late. When should they start worrying beyond a point and approach a doctor?
See, menstrual cycles, roughly, we say that they almost follow a pattern once they start. So at menarche, first 2 years, they may be irregular. That time we don't get worried. We tell them, wait, even if you're missing periods for a couple of months, even if you're having periods, say, for a longer period of time, first 2 years of menarche, we do not worry. The mothers and everybody should be a little relaxed. They should not uh, jump that kuch treatment dena hai, right? But as after 2 years have passed and your regular cycles have started, so mostly everybody has a 30 to 40 days cycle. That is the range. So if you've been having a 40-day cycle always, you should not be worried. But if you've been having a 28-day cycle and you suddenly start missing by 10 days, then you should be worried. So, any change in your pattern is more significant rather than a fixed amount. So, suppose you are having a period flow of 3 to 4 days every month, and suddenly you start having a period flow which lasts for 10 days. So, you need to see a doctor. Suppose you were using just 3 or 4 pads per day in the first 2 days, and now you need to use 7 or 8 pads a day, and you have large clots. That means it is more. Any clotting, heavy clotting, is considered as abnormal. Any longer flow more than 7 days is considered abnormal. Any cycle length which is beyond 40 days is considered as abnormal. These are the signs when you should be reaching out to your doctor.
You've been practicing in Uttarakhand for the last 25 years. Are there any women's health issues which are specific to this region, which typically you've seen, very prevalent in the area?
Yes, hypothyroidism is a problem which is quite prevalent in the hilly region. It is said that the hilly belt used to have a lot of goiter because we used to have a lot of hard water. So initially, we used to have a lot of people with big necks we should see in the Himalayan belts. But ever since we've had iodized salt coming in and So we don't see goiter, but we see a lot of subclinical hypothyroidism and hypothyroid, even clinical hypothyroidism is more prevalent in the Himalayan regions and in the Dehradun belt. Besides this, white discharge amongst females is also quite prevalent. So these are two specific things which I've seen, and especially the ladies who come down from the hills, they have a higher birth order, so number of children and less access to health care. So cervical cancers and cervical related issues are more in the hilly regions, which are not in comparison to the plain belts and Dehradun per se.
You just spoke about women in the hilly areas having a higher birth order. What are some of the things that you wish every woman knew before starting their pregnancy journey?
See, we Asians are deficient in folic acid because primarily we are a vegetarian based diet. So, before you are planning a conception, start folic acid as early as possible. Even 1 month preconception is a good idea. But in case you have conceived already, please start folate as soon as you come to know. It's a very simple folic acid you can ask from the chemist store anytime you will get it. So this is something everybody should know. And nowadays, I would say ki I request the girls to start thinking about childbearing early, because nowadays the concept is late marriages, and then they want to don't plan a family for a very long time, and by the time they reach out to us, their ovaries have started to show decline, and then they need a lot of assisted reproductive methods to help them conceive. So we have to understand that by 26 our fertility reaches its peak, and after 26 years it begins to decline. So the later we conceive, there will be a difficult period. We will go through a lot of problems. Some fortunate ones would be there. But on an average, what science says, it says ki we should try to plan a pregnancy before 30. After 30, there are more complications which will be encountered during their pregnancy journey. So, for a healthier pregnancies, we should aim at a pre 30 years time.
Pregnant women get so much advice from everybody, across doctors, relatives, and everyone, friends around. What are some of the myths amongst these little advices that you would like to bust for pregnant women?
Pregnancy is, again, as I said, it's a very beautiful journey, and God has made it so beautiful that every stage of pregnancy, it prepares your body. So you don't deliver in 2 months. So every first trimester there are different kind of challenges. So you will have a lot of gut issues, you may have bloating, you may have throwing up. So at that time you need to change your diet. It's not that you're not eating anything. So there is some people say bilkul papita nahi khana hai, so bilkul dry fruits nahi khana hai. So whatever you've been doing, always you have to do these things. Have been said because these things tend to be heavier on the gut, so they may increase the gut problems that you're having. Hence, your doctor may just say to avoid. But they are not that if you have a papaya, you're going to miscarry. So these are myths. They're not actual problems. So go and talk to these about whatever problem you are having to your doctor. Rather than reaching out to the internet, finding it elsewhere, please talk to your doctor, because during a pregnancy, I'm sure you are consulting a doctor. Nowadays, everybody visits the doctor. So please write down all your problems and go through with your doctor. The doctor is going to guide you, because what is normal for one person can be abnormal for the second person. So everybody's pregnancy is different, and that is why the doctor looks after it and decides what is best for your pregnancy. So suppose you have a patient who has diabetes, I would not allow fruits to her. Suppose there is somebody who has a family history of hypertension, we would give her a different kind of diet. And what is stressful for her may not be stressful for another person. So that is why we need to talk about our problems to the gynecologist, and they will guide you what is best for you.
Can you share a personal anecdote or a real story of a patient that can help pregnant women feel a little calm on how you supported her? during the journey?
See, each pregnancy is such a novel thing. I don't remember which to cite. But there is this person who's very close to my heart, and I remember how she was trying to conceive for a very, very long time, and she would not. She We tried everything for her, and we tried even IVF. At that time, it was difficult. It is 18, 19 years back, and we couldn't. Give her a positive pregnancy test, and somehow I was so attached to her, and I told her, I said, just give up everything and let's just forget it, and God may have some other plans, and sometimes we may. And unfortunately, we had another mother who wanted to give her child for adoption. So I just remembered of this lady, and I gave her a call and I said, see, there is this woman who thinks that she cannot bring up this child and she wants to give this child for adoption. So, would you want to go through this? She said, ma'am, I'm already 8 months pregnant. And that was, I think it just was like music to my ears. And I didn't know, I was very, very happy. So that patient came a few months back with her 18-year-old son to meet me, and that was like being a mother again. So that is how, for gynecologists, each time we deliver a woman, we become a mother again, and that is the connect that we have with them.
Wow, ma'am, what a strong statement. So we have touched upon, puberty issues with girls. We have touched upon pregnancy issues, pre-pregnancy issues. Uh, let's touch upon some menopause issues as well. Can you name a few myths that come to you for menopause and how would you bust them?
Menopause again is the final stage of change that you are going through, and most females find it the most difficult part to tide over, because somehow it has been associated with aging, and everybody accepts aging in a different way. Some people will take it in their stride, but most feel that there is the youth that is going from us. So their own health somehow takes a second. So that is what I want to tell them. This is not the end. So you may have a difficult menopause, you may be having a lot of bleeding issues. The most important myth which I have seen in my clinical practice is that when they go through a lot of bleeding during the menopause, they take it as normal. They just bleed for months together. So much that it affects their hemoglobin, their strength goes down, they're not able to do their regular work, and then they will talk amongst themselves, they say, तो normal है, सबको पीरियड बंद होने के समय होता है. It's not normal. A normal menopause would be when you're menstruating lesser and lesser with age. Either the frequency is lesser or the flow is lesser. That is how a normal menopause should be. Once in a few months, suppose you've missed a cycle for 3 or 4 months, and then you get a heavier flow for 4 or 5 days, that is still acceptable. But any flow which goes beyond that, please go and see a doctor. Every year, even if you've not done your yearly checkups before, this is the time you should start thinking of yourself. All your life, young life, you have spent bringing up your children, looking after your husband, looking after the home, so many other issues. Working women looking after their careers. This is the time to just sit back, think about yourself, prioritize yourself. Your health is prime. This body has stood by you through all the ups and downs from the time of menarche. Now it wants a little bit of pampering from your side, and only you can pamper it. So look after yourself, exercise well, have your food on time, make sure your diet is having good amount of protein, do what you've been wanting to do. because you were not able to swim when you were having your menstruation. Now you can swim all 30 days. Not an issue. So look at it in that way. Start positively exploring things which you've always wanted to do. And it's not a time when you have to just age. You have to focus on your health. And I have seen a lot of menopausal women doing whatever they've wanted, climbing mountains, doing good amount of biking, and it's not the end. This is where you're starting the best half of your life, so just do it best.
That's a brilliant perspective on menopause, ma'am. Because, as you rightly said, women do tend to ignore a lot of their issues and put it on the back burner because something else is more important. But this is why we have introduced this platform, because women's health matters. Women matter.
Definitely.
And thank you so much for coming and discussing so many trivial issues with us, so in so much detail. Thank you, Dr. Manisha, for discussing such critical issues today, busting myths around periods, menopause, and pregnancy. And for all the women watching out there, I hope this session helped put some things in perspective. Your health matters. Yearly checkups are a must. Why? Because preventative healthcare is better than reactive healthcare. Stay tuned for the next episode of Woman Ki Baat.